lasts. Over 4.1 million companion robots are already deployed in homes and care facilities around the world right now, and most people are completely unaware that this is happening. Today, we're getting into companion robots, what the science actually says about whether they work, why the ethical debate is being fought on the wrong battlefield, and what this all means for the loneliness crisis that's quietly reshaping modern life. By the end of this episode, you'll know how to separate the real evidence from the marketing hype, and you'll have a sharper lens on one of the most quietly consequential technologies of our time. I've got someone here who has been deep in this space, so let's not waste a second. What even is a companion robot, and why should anyone care right now?
So, a companion robot is essentially a robot designed primarily for social and emotional interaction rather than physical tasks. We're not talking about a Roomba vacuuming your floor. We're talking about devices built to converse with you, respond to your emotional state, and in some cases, physically comfort you. The category is actually pretty wide. You've got social robots, elder care robots, pet-like robots, and now full humanoids entering the space.
And the market is already enormous, right? Like, this isn't a future thing.
Not at all. According to market data, over 4.1 million companion robots were actively deployed worldwide in 2023 alone. Japan leads with over 1.3 million units, primarily in elderly care. The United States follows with over 880,000 units used across homes and assisted living facilities. And the US market specifically was valued at $1.2 billion in 2024, with forecasts putting it at $6.5 billion by 2033.
That's a staggering jump. What's driving that kind of growth?
Two things colliding at once: an aging population and a loneliness crisis. Research cited in a Frontiers Psychiatry case series from January 2026 notes that roughly 1 in 4 older people experience social isolation worldwide. And in Japan, nearly 29% of the population is already aged 65 or over, with a substantial proportion living alone. You've got this massive demographic that needs support, and not enough human caregivers to provide it.
So companion robots are essentially stepping into a gap that human infrastructure can't fill. That's exactly the pitch. And it's not just elder care anymore. The market data shows demand expanding into childcare, mental health therapy, and education. Social and pet-like robots accounted for 58% of total global deployments in 2023, which tells you people aren't just buying these for medical reasons. There's a genuine consumer appetite for robotic companionship.
Okay, I want to pause on that for a second because I think there's a cultural moment here that's worth naming. We grew up with C3PO and R2D2, with Baymax from Big Hero 6, this idea of a robot that genuinely cares about you. And now that's kind of real, but it looks nothing like the movies.
Right, and that gap between expectation and reality is actually really important. The robots that are getting the most clinical attention right now are not humanoids. One of the most studied is Paro, a robotic harp seal. Fluffy, tactile, non-verbal. It's FDA cleared and has appeared in multiple ward studies showing reduced agitation in dementia patients compared to plush toys alone.
Wait, a robotic seal? That's the one with the most clinical evidence?
It sounds almost absurd, but there's a real reason for it. According to a Beyond Tomorrow analysis from May 2026, Paro's tactile nonverbal design actually avoids the language frustration that chatty humanoid robots can cause in dementia patients. When someone has cognitive decline, a robot that tries to hold a conversation can be more distressing than comforting. A soft seal you can hold? That's a different experience entirely.
That's such a counterintuitive design insight. Less sophisticated, more effective.
And it points to something the whole field is grappling with, the difference between what looks impressive and what actually helps people. Because on the other end of the spectrum, you've got humanoid robots like Ameca from Engineered Arts, which has hyper-realistic facial expressions, or the Neo home robot from 1X Technologies, which can handle meal prep and cleaning. These are priced between $20,000 and $30,000.
$20,000 to $30,000. That's a car.
Exactly. And then you've got Joy for All companion pets at $149 on the other end. So the range is enormous, and the question of who can actually access these things is one we need to come back to.
Let's hold that thread. But first, what does the actual science say? Because I feel like there's a lot of marketing language around this space, and I want to know what's real.
That's the right instinct. The honest answer is, the evidence is promising but genuinely mixed. A 2022 systematic review published in BMJ Open found mixed but leaning positive effects on depression scales when robots offered sustained interaction over 8 or more weeks. but the effect sizes were modest, often a Cohen's d below 0.4, and novelty effects faded without staff facilitation.
So the robot stops being interesting after a while if nobody's helping to make it interesting.
Basically, yes. And that's a really important operational detail that gets lost in the hype. The Beyond Tomorrow analysis from 2026 makes this point clearly. Cognitive training robots can improve engagement metrics, but gains depend on trained facilitators customizing content. Off-the-shelf Smalltalk underperforms structured programs led by occupational therapists.
So the robot is a tool, not a replacement for human expertise.
That's a really clean way to put it. And there's a study that I think really crystallizes why the design of the robot's personality matters enormously. A research team, including scientists from MIT, published in ACM SIGCHI in 2023, ran an 8-week deployment study with 70 participants. They compared 3 types of robots, one with only assistant-like skills, one that acted like a coach giving instructions, and one that behaved like a peer, supportive, sharing the journey rather than directing it.
And let me guess, the peer robot won.
By a significant margin. The companion-like, peer-style robot was the most effective at building what researchers call a therapeutic alliance, that sense of genuine connection. And it enhanced participants' well-being and readiness for change more than either of the other two. The researchers concluded that companion AI agents could enhance mental health interventions specifically by strengthening that therapeutic alliance over the long term.
That's fascinating. It's not about how smart the robot is, it's about how it relates to you.
Which actually aligns with what we know about human relationships. People don't want to be lectured, they want to feel like someone is in it with them. And a robot that positions itself as an authority figure, even a helpful one, creates a different dynamic than one that says, essentially, I'm here with you.
There's something almost philosophical about that. The robot has to be humble to be effective.
And there's a real-world case that illustrates the long-term dimension of this. A case series published in Frontiers Psychiatry in January 2026 out of the University of Osaka followed 5 women aged 85 to 90, all with mild cognitive impairment or late-onset psychosis, who used a conversational companion robot called RoboHon in their homes for 18 months.
18 months is a long time. What happened?
So the standardized psychological scales didn't show consistent improvements, which is the honest, complicated part. But all 5 participants operated the robot in daily life with only minimal support from caregivers. They reported enjoying conversations with it, and 4 out of 5 expressed a desire to continue using the robot after the study ended.
4 out of 5 women in their late 80s with cognitive challenges wanted to keep the robot. That's not nothing.
It's really not. The researchers called it evidence of feasibility and long-term acceptability, even in vulnerable populations. And that matters because most studies in this space have focused on short-term use or institutional settings. This was people living at home, managing the technology themselves, sustaining engagement over a year and a half.
Okay, so we've got real evidence of engagement and some evidence of emotional benefit. But you mentioned earlier that the evidence is mixed. Where does it fall short?
The clearest gap is in physical health claims. Some vendors imply cardiovascular or fall prevention benefits from companionship. According to the Beyond Tomorrow analysis, peer-reviewed evidence for those endpoints remains thin. The honest picture is that companion robots are showing real promise for loneliness, mood, and agitation. But the further you get from emotional support and into physical health outcomes, the weaker the evidence gets.
So the marketing is running ahead of the science in some areas.
Consistently. And that's where the ethical conversation becomes really important. Because there's a version of this technology that genuinely helps people, and there's a version that exploits vulnerable populations with overpromised benefits. The research community is actively trying to draw that line.
Let's get into the ethics then, because I think this is where it gets genuinely interesting and maybe a little uncomfortable.
So, the philosophical debate around companion robots has traditionally focused on things like deception. Is it wrong to let someone form an emotional bond with something that isn't sentient? And infantilization, the idea that giving an elderly person a robot pet is somehow demeaning. Those are real concerns that ethicists have raised.
And those feel like the obvious concerns, right? Like the ones you'd expect from a philosophy seminar.
Exactly. But here's what's really striking. A study published in BMC Geriatrics surveyed 67 younger adults who had actually interacted with companion robot pets at an exhibition. When asked openly about ethical concerns, 60% reported having none at all. Only 10% flagged reduced human contact, and only 6% flagged deception.
So the concerns that dominate the academic literature aren't the ones regular people actually have.
Right, and when those same participants were given a list of potential concerns to rate, the top scoring issue by a significant margin was equality of access based on socioeconomic factors. It scored 4.72 out of 7. Infantilization scored 3.45. Deception scored 3.44. The thing people were most worried about was whether everyone could afford one.
That's such a grounding finding. The philosophers are debating whether it's deceptive, and regular people are asking who gets left out.
And that gap between the philosophical debate and the lived concern is itself an ethical issue. Because if companion robots genuinely reduce loneliness and agitation, and they're only accessible to people who can afford a $6,500 Paro or a $249 a month LEQ subscription, then we've built a two-tiered system of emotional support. That's a serious equity problem.
And the BMC geriatric study found that cost was a common reason people said they wouldn't purchase a device for an older relative, right?
Exactly. Over half of participants, 58%, said they would buy a companion robot for an older relative, but cost kept coming up as the barrier. And that's a real tension because the Geron technology robotics market drew roughly $400 million in global revenue in 2025, according to Beyond Tomorrow, which sounds big but is still tiny compared to other healthcare technology sectors. The investment is there, but it's not yet translating into affordable access.
There's also a broader ethical framework question here, isn't there? Like, who decides what values these robots should embody?
That's exactly what a research group from Ghent University and Politecnico di Milano tackled in a paper published in late 2025 for the International Journal of Social Robotics. They did a scoping review of human-robot interaction literature across healthcare, education, and private homes, then ran focus groups with technology ethics experts to map out the key values at stake. They actually built a tool called the HRI Value Compass to help robot designers identify and embed human values into their designs.
A compass for robot values. That's a concept I didn't expect to encounter today.
It reflects how seriously the research community is taking this, because as that paper notes, robots are no longer just complex tools, they're becoming social agents with real consequences in high-stakes environments. And when something has social and physical consequences in someone's home or hospital room, you need a framework for thinking about what it should and shouldn't do.
And over 67% of deployed companion robots globally are already equipped with emotion detection algorithms, according to the market data. So these things are already reading people's emotional states.
Which is both the promise and the concern in one number. Emotion detection is what makes a companion robot feel genuinely responsive rather than scripted. But it also means the robot is collecting intimate data about how you feel, when you feel it, in your own home. The BMC geriatric study found privacy concerns scored the lowest of all ethical issues, 2.17 out of 7, which suggests people aren't thinking about this dimension yet.
That's a little alarming, honestly. People are more worried about cost than about a robot tracking their emotional state.
It might be that the cost concern is just more immediate and tangible, or it might be that people haven't fully processed what emotion detection at scale means. Either way, it's a conversation the field needs to have more loudly.
Let me ask you something that I think a lot of people are quietly wondering. Can a robot actually replace human connection? Or is that the wrong question entirely?
I think it's the wrong question, and here's why. The research consistently frames companion robots as a supplement, not a substitute. The Beyond Tomorrow analysis is explicit that these robots pitch emotional support without replacing nurses. The ACM SIGG study was about enhancing mental health interventions, not replacing therapists. The Osaka case series involved caregivers still providing light touch support alongside the robot.
So the robot works best when it's part of a system of care, not standing alone.
And that reframe matters a lot, because the fear that robots will replace human caregivers is actually getting in the way of deploying them where they could genuinely help. The Beyond Tomorrow analysis notes that in the US, staff skepticism is one of the things slowing rollouts, alongside liability concerns and Medicaid rules. So the technology exists, the evidence is building, but the institutional friction is real.
That's a frustrating gap. The people who could benefit most are in facilities where the staff are skeptical and the reimbursement rules don't cover it.
Exactly. And South Korea is an interesting contrast. The market data shows the government invested in over 13,500 elder companion robots by the fourth quarter of 2023. That's a policy decision, not just a market one. When governments treat this as infrastructure for aging populations, the deployment picture looks very different.
So the technology question and the policy question are completely intertwined.
They always are with healthcare technology. And I think that's actually the most underappreciated dimension of this whole space. We spend a lot of time asking, does the robot work? And not enough time asking, who decides who gets one and under what conditions?
That's a really sharp way to put it. And it connects back to that BMC geriatrics finding. Regular people are already asking the access question. The researchers and ethicists just need to catch up.
And the market is moving fast regardless. The global companion robots market was valued at around $540 million in 2024 and is projected to reach over $1.8 billion by 2033. The US market alone is forecast to grow at a 20.3% compound annual growth rate through 2033. These things are coming into people's lives whether the policy frameworks are ready or not.
Which is kind of the story of every major technology, isn't it? The thing arrives before the rules do.
Every single time. And with companion robots, the stakes feel particularly high because the people most likely to be affected, elderly adults, people with cognitive impairment, people experiencing severe loneliness, are also among the most vulnerable. Getting this wrong has real human costs.
So when you step back from all of this, the market data, the clinical trials, the ethics research, what does it actually come down to?
It comes down to a genuine tension between real promise and real gaps. The promise is this: companion robots, when designed to behave like peers rather than authorities, can build meaningful therapeutic alliances. They can reduce agitation in dementia patients. They can sustain engagement in people who are isolated and cognitively challenged over months and years. That's not nothing, that's actually significant.
And the gaps?
The gaps are that the evidence is still modest in scale, the novelty effect is real and fades without human facilitation, physical health claims are largely unsupported, and the access problem is enormous. A $6,500 therapeutic robot is not a solution to a public health crisis. And the emotional data these robots collect deserves far more scrutiny than it's currently getting.
Here's what I keep coming back to, though. The fact that 4 out of 5 women in their late 80s, living alone with cognitive impairment, wanted to keep their robot companion after 18 months, that's a data point that's hard to argue with on a human level. It really is. And I think that's the thing that should anchor this conversation. We can debate the philosophy, we can scrutinize the market projections, but at the end of the day, there are people who are profoundly isolated, and a robot that they enjoy talking to and want to keep in their lives is doing something real for them. The question is how we build systems that make that available to everyone who needs it, not just those who can afford it.
And that's actually an actionable question. It's a policy question, a design question, a funding question. It's not just a philosophical one. Exactly. And the research community is starting to build the tools to answer it. The HRI Value Compass from Ghent University, the long-term deployment studies from Osaka, the Therapeutic Alliance research from MIT. The scaffolding is going up. The question is whether the institutions and governments move fast enough to use it.
So here's what this really comes down to for anyone listening. Companion robots are not a sci-fi fantasy. They are a present-tense reality, with 4.1 million units already deployed globally. The science says they work best when they act like friends, not experts. The ethics debate is being fought in the wrong place. Regular people aren't worried about deception, they're worried about who gets left out. And the technology is scaling faster than the policy frameworks designed to govern it.
And if you take one thing from this conversation, let it be that the design of these robots, specifically whether they position themselves as peers or authorities, matters enormously for whether they actually help people. That's not a technical detail, that's a fundamental choice about what kind of relationship we want technology to have with the most vulnerable people in our lives.
We started this episode with 4.1 million robots already out there in the world, quietly keeping people company. And here's the thing. The question of what makes a good companion, whether it's made of silicon or skin, turns out to be exactly the same. It's not about how smart you are or how many tasks you can perform. It's about whether you show up, stay present, and make someone feel like they're not alone. Thanks for listening to Copilot Podcasts.